You ready?
Yeah, I'm
Okay.
ready.
Oh, I love it. She's always ready. No, I just met her actually. Guys, say hi to Dr. Mercy, medical officer from the Nairobi Hospital, which
Hi.
means today we're tackling another topic that we should all learn to understand more and think about what we can do to prevent liver disease. Gosh,
Yeah.
I was when I was told that we're going to be talking about liver disease today, I was thinking, how many people actually know what your liver does for you?
Yeah, exactly.
So what does a liver do for us?
All right, so maybe we can back it up a bit. So even some people may not even know what the liver is. So yeah, the liver is an organ. It's found at the right side of your abdomen somewhere.
It's always right?
Yeah, usually, mostly right side of your abdomen, just below your diaphragm, somewhere there.
Okay.
Yeah, and it's above your intestines and your right kidney. So the liver in the body acts as a factory. So yeah, it acts as a factory. It helps in production of many things. One of the things includes bile, which helps in digestion, especially digestion of fats. It also helps in production of glycogen. Okay, so when you have excess glucose in your body, it's converted to glycogen, and when you need it, it's converted back to glucose, and the liver helps do that.
And glucose is sugar.
Sugar. Yeah, exactly. Okay. Yeah. In addition to that, the liver also helps in production of amino acids, and the amino acids will build in blocks of proteins, and this will be converted into clotting factors in your body. Helps you stop bleeding.
Oh, that's very important.
Exactly. So if you have liver failure, you can end up having lots of bleeding disorders.
Oh, so like if you scratch and your wound never heals.
Exactly. Or when you cut yourself, you have uncontrollable bleeding.
Oh, gosh.
Yeah, if you have liver issues.
Okay.
Yeah, things like that. It also helps in production of antibodies, which help fight disease.
Okay, so the liver is super important.
Very important.
Just as important as, I guess, the heart, the brain, all these other organs that we seem to know a little bit better. But the liver is like that guy in the background that's been following.
Exactly.
Okay,
Yes.
so liver disease. I mean, I guess there must be so many types since, you know, it has so many different functions. So what are some of the different illnesses that we can get?
Okay, so when you say someone has liver disease, it means their liver is not working. And this can be due to a couple of things. So we usually like to classify them into two. Hereditary, maybe they got it from parents through generational, but that is a topic of another day. Yeah.
Oh, okay.
Yeah. And then the most common causes of liver disease are acquired. And in the acquired causes, the most common cause that is on the increase is alcoholic liver disease. Yeah.
I feel like every time we're with someone from the Nairobi Hospital, we talk about alcohol consumption.
Exactly.
Curb your alcohol consumption.
Yes, and do you know the amount of alcohol someone needs to take?
I guess in a perfect world, 0?
In a perfect world, 0. Yeah.
I'm not perfect.
Yeah, it's okay. But if you are to take alcohol, for males, we usually say 21 units. And 1 unit is 1 tot of alcohol, or 1 tot of hard spirits, or half a pint of a beer, or a normal glass of wine.
Is that per day?
That is per week. You should take, for males should take 21 units of alcohol per week. Females, it's less, 14 units of alcohol per week.
Divide that by 7, guys. That
Exactly.
means only 3 tots per day.
Exactly.
How have you guys been doing? I don't know. Oh my gosh, wow.
Yeah.
Okay. And anyone who starts consuming beyond that?
Yeah, beyond that can get alcoholic liver disease. What happens is the alcohol directly damages the liver cells and will cause inflammation of your liver. And this sometimes can lead to scarring of your liver. When your liver gets scarred, you've heard of something called liver cirrhosis?
No, but great.
Yeah. So
I mean, not great.
Oh, all right.
Or, yeah,
No.
You know what I mean.
Yeah. So when your liver gets scarred, your liver, by the way, is one of the organs that can be able to replicate itself. But when scarring occurs, then that replicating ability to be able to replicate the damaged cells cannot happen. Yeah.
So it is reversible in a way because your liver regenerates.
Exactly. Your liver can regenerate.
But if there's scarring, as in if you drink too much alcohol and it's directly damaged your liver, it doesn't regenerate
exactly.
anymore.
Yeah. Yeah, so those are one of the causes, alcohol.
Okay.
The second one is drugs, other certain drugs. Have you heard of, I think the most common maybe they may have had is taking excess amount of Panadol, paracetamol, that can directly damage your liver, and this damage happens within 6 to 12 hours. So if you know someone who has taken excess amount of paracetamol, or you have done that, kindly go to your nearest hospital or medical facility. Yeah.
Okay, and how do you get screened for liver diseases or things like that?
Yeah, so we usually do a couple of tests. The tests we do are, liver function tests to be able to see if your liver is doing well, and be able to look at all the liver enzymes, and if they are elevated, or which will show that there is some damage in the liver, or we can do an ultrasound. In addition to that, we also screen for infective causes of liver disease. Including hepatitis A, B, and C. And I think these are the ones that people may be mostly familiar with. Yeah. So hepatitis A is pretty common in Kenya. It is actually transmitted through poop, fecal, oral. So if there is food that is contaminated with with someone's fecal matter that has hepatitis, you can get hepatitis A. The good thing about hepatitis A is it is self-limiting. Within 2 to 4 weeks, it should have resolved it on its own, although you will still get symptoms of liver disease, which we shall discuss.
Okay.
Hepatitis B and C are transmitted through someone coming into contact with someone else's, an infected person's bodily fluids. That includes blood and sexually transmitted fluids. Yeah. So if someone is probably doing IV drug abuse or is having unprotected sexual practices, they are at risk of getting hepatitis B and C.
And is there like out of A, B, and C, is there like a worse to get?
Yeah, so hepatitis B, C, then A. Hepatitis B and C usually lead to chronic inflammation of the liver. So chronic means a long-term inflammation of the liver, which leads to scarring of the liver, can lead to liver failure, and eventually can lead to someone getting even hepatocellular carcinoma, that is cancer of the liver.
Wow.
Yeah.
So in regards to just the liver itself, we cannot live without it, right?
No.
There's no you can cut part of it and hopefully it'll regenerate or something like that? Okay,
so in some instances, we do liver transplants. Yeah, so for instance, remember we mentioned the liver is one of the organs that regenerate itself. So if I have a bad liver and you're a match, you can give me a portion of your liver and yours will grow back and mine will grow.
So you don't have to take all of mine?
No, we don't take all of yours.
Oh, yeah. Okay, so it's like it could be a living donor.
Exactly, it's usually a living donor. But we do not like to get to that level. Yeah. Oh, and then another cause of increase of liver disease is fatty liver, because of people eating unhealthily. They usually get lots of fat stored in the liver, which is as damaging or a bit less damaging than alcohol. It also causes inflammation and can lead to liver failure.
But so would that person most likely be obese?
Sometimes they can be obese. At times they can be as small as you, but because of their food practices, what they eat, they still have a lot of cholesterol in the blood and a lot of cholesterol in the liver.
So it's the cholesterol that's
exactly.
the problem. So back to the hepatitis story, you said the most severe is B, then C, and then A. What are some of the symptoms, first of all, that someone can notice that they have some form of hepatitis and they need to seek help? Okay, so this is not just for hepatitis itself is just inflammation of the liver, and as you've mentioned, those ones are causes of viral hepatitis. So anyone with liver disease would have nausea, probably. You want to vomit, or sometimes you can actually vomit. Yellowness of your eyes, if you have that, you need to yellowness of your eyes, or if you're light, yellowness of your skin, you need to go see a doctor. Then remember we said the liver is located right up here. If you have pain right up here at the right upper abdomen, then you need to seek medical attention. Is it where your last rib is, or even higher? Anywhere within where your last rib is, and still a bit higher, coming out that way. Then you need to seek medical attention. In some cases, if like your liver has failed, as we mentioned, you can have bleeding disorders. If you're easy bruisability, you need to seek medical attention.
and yeah, things like that. Yeah.
Okay, so what can we do to prevent getting any form of liver disease? I know you spoke about alcohol consumption and cholesterol and things like that, but what else can we do?
Yeah, okay, as we said, reduce the alcohol consumption. The amount of cholesterol that you take in food should be reduced. Exercise, yeah, that one you should do. Then, exactly, yeah. Then hepatitis A and B have a vaccine, so kindly get the vaccine for hepatitis A and B. That will also help. And also, if you are engaging in sexual practices, you know how the A, B, and C's of sexual health. If you can't, okay, if you want to abstain, you can abstain. Be faithful to your partner and use a condom. Those are the 3 things you can do.
A, B, C.
Yeah, of sexual health practice.
But what are some of the numbers that affect Kenyans?
Okay, so usually due to Kenya being a third world country, we would have more of the infectious liver diseases, hepatitis A, B, and C. But as our economy is growing, which is a good thing, yeah, we are having now patients coming in more with fatty liver due to a lot of cholesterol in food and alcoholic liver disease. So that is on the rise.
On the rise.
Yeah, yeah.
Okay.
And since most of them are preventable, then I think we can be able to prevent ourselves from getting that.
I love how hopeful she is.
Yeah.
And that's what we have to take home with today's message, thanks to Dr. Mercy, is it's preventable, ABCs of sexual practices, but also eat better, exercise more, drink less alcohol, because at the end of the day, you're putting junk in your body, and this is all you have here at the moment, so we gotta take care of it.
Exactly.
And if you have any questions, make sure you leave them below, or go see Dr. Mercy at the Nairobi Hospital. She'll probably help you out and tell you not to drink that much.
Yeah.
Yeah.
True.
I think that was the most important takeaway. But you guys, thank you so much for joining us. Subscribe to our channel. Oh, yeah, Sharon's on leave, but she'll be back very soon in just a couple of days. And we'll see you next time.
See you. Bye.
Check out our 2 Cents playlist for more videos, and don't forget to subscribe.